think World Mental Health Day is hugely important in an effort to make mental health a priority on an individual level, policy level, even on a resource level, and worldwide to address the gap in the need for treatment and treatments available. And especially in low and middle income countries, there's so much less infrastructure around mental health care. And so World Mental Health Day shines a light on mental health as a global need and helps to bring support, attention, and resources to those needs. I really believe that in order to make mental health care a reality worldwide, first we need to remove the stigma around mental illness. So something like World Mental Health Day, if nothing else, says this is something that we can talk about. This is something that exists around the world and that deserves our attention. So if we can kind of reduce the stigma in these ways and move mental health and mental illness into the same space so that it receives the same regard as physical health conditions, I think that will do so much in reducing the burden on people worldwide of mental health conditions. And right now, even the way that we think about that or say that there's physical health and mental health as sort of a binary is really a fallacy. The two are so connected. And in particular, with regard to trauma, a distress response to violence or to crisis events is really a human, natural, and in some cases, an adaptive response to extreme circumstances. An example that comes to mind is some work that we did a few years ago looking at modern slavery worldwide. So a lot of different conditions that exist in terms of inhumane work conditions. And one example that makes me think about the issue around stigma is Ethiopian women who were leaving their families to work as in domestic capacities. So Ethiopian women leaving their home in Ethiopia and moving to the Middle East to work in a domestic capacity and returning home with a lot of trauma experiences. So a lot of these work conditions were really inhumane. And so they returned with a lot of trauma and mental health needs. And yet the communities that they returned to, even their family members, didn't understand those emotional and behavioral responses. And so these women were often shunned. So in addition to returning with the symptoms, then the communities that received them didn't know how to support them and ostracized them. So one of the pieces of intervention that we did around this was to educate the families about trauma and some of the responses that happen so that when these women returned, their families could support and help them recover from those experiences. So even at that individual level, there's shame and stigma around mental illness and trauma response, all the way up to the highest level around policy decisions and things that impact resource allocation. So, I think World Mental Health Day is one step that can play a big role in educating people worldwide around mental illness and mental health in order to reduce the stigma and provide more support to people where the needs are greatest.